The U.S. Army Corps of Engineers has been working on an initiative called Engineering with Nature. It all started in 2010. And this is the EWN Podcast. EWN is developing and implementing nature-based solutions for water and infrastructure projects. It's bringing together a growing international community of scientists, engineers, and researchers from all kinds of disciplines that are committed to harnessing the power of nature to solve problems. The EWN Podcast tells their stories. Now here's your host, Sarah Thorne of Decision Partners.
Welcome to Season 8, Episode 2. Jeff King, lead of the Engineering with Nature program, and I are really thrilled to be back with Dr. Chris Lemon. Welcome back, Chris.
So glad to be back. Thanks, y'all, for having me.
Well, Chris, we're still buzzing from that previous conversation that we had with you, and we can't wait to see where this conversation is going to take us. And I'm eager to learn more about this emerging field called planetary health.
I agree. In the previous episode, we had a really fabulous conversation with Chris about his journey from studying environmental science to becoming a medical doctor at Johns Hopkins Department of Emergency Medicine, to becoming a Bloomberg Fellow, and most recently, a member of the Planetary Health Alliance. Chris is truly an expert and a thought leader in this new and evolving field of planetary health. And Jeff, our conversation with Chris sure inspired us. I hope it inspires our listeners.
Oh, absolutely. I just know that this has touched so many people and has them really thinking about where this is going. And certainly they're probably asking the same questions about planetary health. I do think that for our listeners that are starting out in their careers, this is going to be especially important for them. And as Chris pointed out, there is just so much work to be done on helping people transition and adapt to changing conditions posed by climate change. All that said, I hope today's conversation will get people at all stages of study and work think about how they can make a difference.
I'm sure it will. Chris, can you set up the challenges of climate change on health? We talked about it briefly in Season 8, Episode 1. In a nutshell, in your recent presentation to the Department of Defense group where Jeff first met you, you said the degradation of natural systems is now the leading contributor to the global burden of disease. So this is clearly a call to action. Talk about that.
Sure. You're asking an emergency doc to talk about action. It's like, yes, this is the part I was waiting for. Let's go. The call here is clear. Extreme heat, extreme weather, drought, flooding, spreading of vector diseases, all of these things in a society where we need to protect our vulnerable children, our elderly relatives. The fact that all of these complicated situations boil down to the fact that humanity is a part of this planet. We're not trying to get rid of humanity. We need to be at the center of these discussions for our own self-preservation, but we need to be alongside the rest of all life on Earth as we're talking about how do we come about solutions to these things. And so, again, pivoting, as you just said, what's our call to action? If we don't act, our health is going to be impacted. It's already being impacted. So if you care about yourself, or if you don't care about yourself, which plenty of my patients don't seem to, sometimes based on their actions, but if you care about the health of your family and your loved ones, you need to act now, because there is no question everyone is going to be impacted by climate change. Their health will be impacted. The question is, to what degree? And that's a whole different discussion about vulnerability and justice. But I just want you to know, even if you think that you might not be impacted, it will at some point. Personally, my kids go to outdoor summer camp. I never would have thought last summer in the DC area that it was unsafe to send my kids out on a purple quality air day, meaning that it's awful air from Canadian wildfires. That was not something I thought about when signing my kids up for camp in this area. It's happening now. And so just to share a little bit more of some actual facts, because again, we're always balancing stories that are very important and impactful, but also the data that helps to influence policy. There's this wonderful body of work called the Lancet Countdown on Health and Climate Change. They release a global report, and of course, we're working with 2023's data from last year. Over 100 experts come together offering a glimpse of the dangers we face from climate change, but also the opportunities at hand to deliver a future that's still thriving. And so inefficient action already has led us to be 1.14 degrees centigrade warmer than before. I mean, that's a rough estimate. People hear about 1.5 being sort of this make or break moment. The reality we need to face here is this is not a on-off switch here from safety to not. This is a spectrum that we're already feeling. So we need to start the actions now as fast as possible. The health consequences are rapidly worsening. Look at the extreme weather that we're having going on here. Heat-related deaths of adults over 65 have risen by 85% since the 1990s, over twice the increase expected if temperatures hadn't changed at all. And then the increased frequency of heat waves and droughts in recent decades was associated with roughly 127 million more people experiencing moderate or severe food insecurity. And new locations now are suitable for the transmission of deadly infections. And I think I mentioned before, I'm getting alerts about Marburg virus, P. falciparum malaria. We're all talking about Mpox again right now. We just recovered from COVID. This is not a theoretical thing. We're seeing concerns and we're wondering, is this going to get worse with climate change? These impacts could be an early sign of the future that we have in store. And with the projections on the track that they are, I think we're facing a scenario where things could be potentially catastrophic and devastating. And that also means to your health.
So it's important that we focus on action. As you said, we have to take action now. So talk to us, Chris, about what must be done, what is being done, and some of the big gaps and opportunities that you're seeing. And talk to us about this new discipline that you introduced us to called Planetary Health.
Sure. So like many of us, I think I came into this thinking climate change. And then, okay, health has a role in this. There have been people talking about climate change and health for a while. And at Hopkins, I happened to be in the right place at the right time when this amazing group called the Planetary Health Alliance moved down from the Northeast to start a transdisciplinary institute at Hopkins. And they introduced me to planetary health. It's a concept I had heard but never really understood. Again, to kind of reiterate what we use as a definition, planetary health is, again, a solutions-oriented transdisciplinary field, but it's also a social movement, and it's focused on analyzing and addressing the impacts of human disruptions on Earth's natural systems and how that will eventually impact human health as well as all life on Earth. So I have a lot of people ask in terms of, well, how does this relate to One Health, or what's the difference between this and climate change? I tell people we're all looking at very similar problems, but we are all looking at it through our own perspectives and our own viewpoints. Planetary health is just another lens upon which to look at this, but it's recognizing that it's not just climate change. It's also land use, it's biodiversity loss, it's plastics pollution. There are many other aspects of what we're doing to natural systems that are going to impact our own health beyond just all the scary stuff I told you about climate change. And so again, not to be doom and gloom, but I think we, as Sam Myers, one of our founding leaders in planetary health, says, if we want to get the treatment right, we have to get the diagnosis right. And that means viewing this whole problem from this broader macro lens. Doesn't mean everybody has to engage every aspect, but it certainly gives you a greater surface area upon which anyone can engage something that they find important.
Well, that message and the need for urgent action is pretty clear. And Chris, can you tell us a little bit more about this group and the Planetary Health Alliance? How did that come about?
Sure. So it's apparently been almost 10 years. There was sort of a call to action about these issues. There was a recognition that, since 1950, the human population has increased by about 200%. Fossil fuel consumption is up about 550%. We're fishing our marine systems over 350% of where we used to. We've dammed up more than 60% of our rivers, and we've cleared about half of the temperate and tropical rainforests. And to be honest with you, we're using about half of the livable surface on Earth to propagate our own food supply. It started to become very clear to us that as we're pushing and pulling on all of these natural systems, there's a bigger issue at hand. And so they ended up defining this as this concept called planetary health. And it's funny, as a doctor, I approached Johns Hopkins Department of Emergency Medicine talking about climate and health. And they're like, okay, we get it. We'll pull you on board. And very tongue in cheek, my chair heard planetary health. And he's like, what is this, like intergalactic warfare? Where are you going with this now? And so, the point is, though, it's kind of, at first people approach planetary health and they're like, what is that? Are we talking about, kumbaya stuff and everything in a healthcare field? That doesn't always fly so well. And I guess the point that I'm making is when you start to define it as all of these different things that humanity is doing to the earth, to our natural systems, acting as though we're, as we talked about before, above nature, we're starting to see now that the planet is pushing back, equal but opposite reaction. We're degrading things at a pace that's not sustainable. And so planetary health is the idea, just put into simple terms, that it's not just about sustainability. We actually need to transform society and our systems to regenerate, to start to go back towards a balance in our natural systems in order to promote, again, at the center of this, the health of humanity and all life on Earth.
Chris, I looked at the video that was done by the Planetary Health Alliance, and it was just stunning. I would highly recommend it. I've already sent it to my family and several of my friends, and we'll certainly put it in the show notes. But I wanted to share this quote from the video and get your thoughts on it. And I'm quoting here. Underneath the ecological crisis that we've created and the global health crisis that it is precipitating is a spiritual crisis. We've allowed our myth of human exceptionalism to create a rupture between humanity and the natural world we depend on. The reverence and awe that most of us feel towards nature has lost its authority in guiding our decisions. Wow.
Yeah.
So, Chris, what do you think about that?
How much time do we have left? It's interesting, that quote. I've watched that video dozens of times now, and that always hits me right there too, because you're pulling in all these different concepts that this really is it's a spiritual crisis. I've actually had commentary come back to me about the word exceptionalism and describing humanity, with people saying humanity is exceptional. And to some extent, I agree with that when I stop and think about it, but it's, what are we exceptional in relation to? And I think when we're saying we're exceptional in relation to nature, we're figuring out pretty quickly we're not, number one. Number two is, the more we start to listen to, for example, indigenous voices and people who have lived in harmony with natural systems far longer than our industrial revolution, we're starting to realize that nature is the exceptional structure here, and humanity is just living on it right now. But I think that also creates this wonderful call to action, this opportunity for us to say, our generation, our decade is now. We have the opportunity to be involved in how we shape the future going forward in light of this existential crisis. And, if we think back on the greatest issues that people have had in the last couple of hundred years in terms of world wars or nuclear threats, we look back at how these generations that came before us went about solving these existential problems. And I pose to people that, yes, it's very easy to get depressed and despondent, but at the same time, you have an opportunity to be part of this amazing solution that's going to require the entire world to come together over this. So I may still stick with the critics in some regard with that exceptionalism term. We are not exceptional to nature, but I think as a species, our ability to adapt and work in a social group does provide us an exceptional tool to make a path forward.
Chris, that message is so powerful, and I really appreciate you inspiring us with that call to action. And as Sarah knows, we are big fans of calls to action. And so, Chris, you know about the EWN program, and we've talked quite a bit about that. And you know that I'm always interested in pursuing nature-based solutions wherever possible. I was wondering if you would share your perspective on the role infrastructure plays, particularly natural infrastructure, and how that might address sort of the health implications of climate change.
Oh, sure. Again, we talked before about channeling the expertise of others. That's sort of my role here, is to talk about health, but also the things that I'm seeing. And as I've come across the Planetary Health Alliance's organization and learned more about it and become part of, honestly, what feels like a family. This is a family at PHA, and it's a community worldwide. We're talking about examples from, at this point, 450 different organizations from around the world, from NGOs and government organizations and policymakers. It's this amazing convening of individuals from about 75 different countries. And so to talk about what's going on, well, I don't even know where to start. I'm seeing things in a whole new light now that I'm hanging out with y'all from the engineering sector. We were at our annual meeting in Malaysia. We were in Kuala Lumpur last spring, and the Sunway Center and Sunway University put on this international convening to discuss planetary health. And this Sunway Center in Malaysia is basically built upon a degraded tin mine. It was a waste field several decades ago. And in terms of how they've gone about engineering it, we go to what I'm told is the best private university in Malaysia now, the Sunway Center, where their logos and things on the wall are the Sustainable Development Goals from the UN. And this is built within the context of residential areas, shopping, their hospital and medical center. They even have a water park there, but the idea is they're changing the way that we do the built environment to make things walkable, to get people outside. They have plants everywhere. I mean, the concept is blurring the lines between what we traditionally think of as human urbanization and nature and making it cross flow. And this was the entire platform for this international convening that we had. And I think that was, of course, intentional. While I was sitting there, I've got to meet Colin Butfield, who runs Silverback Productions. That's David Attenborough's film producing team. He's just sitting there in front of me. So got to talk to him a little bit, and they announced this whole initiative called Open Planet. If you search for that online, where they're uploading their video resources to try to help people communicate the brilliance of nature in whatever venue they're coming from, so that his content is available for engineers to weave that in. You mentioned when I gave a talk at the DoD and Fish and Wildlife Service convening, everybody talks about the pictures and the video and how that captivated them. Mm-hmm. That's not because I shot it again, but there are other experts in that field that are making that available. So when we talk about infrastructure, I think we need to get nature in front of as many people as possible. We're talking at a macro international level. It's funny, I was walking through the inner harbor of Baltimore the other day, and there's a whole new project now where they're putting wetlands, floating wetlands next to the National Aquarium and putting up signage and walking paths through these and turning them into a park. And the entire idea is to start to educate inner city Baltimore to what was here before inner city Baltimore, and how such simple but very effective nature-based solutions can start to bring life back to the bay, which, again, as a doctor, if you go in that water in the bay, you're getting many antibiotics. So the fact that we're using nature-based solutions to start to engineer that, all these ideas are what I want to bring into our hospitals. I want to find places for these concepts so that people are seeing and learning about these things while they're experiencing healthcare and making that connection for themselves.
Keeping these things so that they're not separating people and nature. I think that's so powerful, Chris. And I think that, there must be an important role for health benefits that come from integrating people with these nature-based features.
I would agree. I'm sure many people have heard about things like providers prescribing a walk outside. Yes. But, that really does have impact. And again, far beyond the capacity of a simple, humble emergency doctor. But when we talk about why our body does what it does and the physiologic systems required for your heart to beat or your lungs to breathe, when we start to unlock the connection between how we understand contemporary medicine and human systems and realize how impacted that is by the aesthetics of the surroundings we're in, think about nature. I mean, what other scenario, short of maybe a rave, do you get all of the senses engaged in terms of when you're out just taking a walk through the woods, what you hear and smell and see and what that can do for calming yourself? It's incredible. I was in a lovely dinner put on by one of our neuroaesthetics experts, Susan Magzaman. She wrote a great book called Your Brain on Art. And basically she had the late Robin Williams's wife, Susan Williams, was there with us talking about the impact of art and nature on neurocognitive decline. Clearly the story of Robin Williams, a very important one with Lewy body dementia. And it was a table of the two of them, the emergency doctor, yay, I find my way into everywhere. But then basically representatives from neurology and neurosurgery and neuroscience from around Hopkins, all sharing ideas about how can we actually start to study more about this connection between humans and nature and the impact that has on health.
We did a wonderful show with Florence Williams, who wrote the book called The Nature Fix.
Nature Fix,
We did that at the end of season 6. And she just laid it out for us, all of the science related to getting people, the benefits of getting people into nature. It's wonderful. I mean, you must see the benefits, but you also must see the consequences of not having people exposed to nature in your work every day.
Oh, absolutely. And that's what, as we start to talk about these existential threats like climate change and planetary health issues, we bounce back to vulnerability as well. It's a saying in Baltimore, especially in trauma centers like where I work, that somebody comes in and they've been shot. First of all, why did they get shot? What are the social constructs that are making that happen? But we can put 20 units of blood into somebody and spend 12 hours in the operating room and they survive and we pat each other on the back. And then 3 weeks later, they come back in and they've been shot again and they're dead. And I guess that's just to say is in healthcare, be it gun violence or any of these other health problems we're talking about from climate change, we're seeing the actual impacts. And we need to find ways to put the nature fix in the hands of our physicians, because again, that's a different superpower we don't have. We understand the health. We need to be able to help make connections the same way that a doctor shows up at a DoD convening, connecting the dots from what the healthcare sector can do to bolster the projects that you all are already designing and working on, because they're absolutely correct in so many ways. We just want to help you succeed with what we can offer.
Chris, you sound so positive, if not excited about the future.
I think what I'm excited about regarding the future and prospects is that it seems like we're starting to see movement growing in terms of creating space for planetary health. So we're certainly not alone, but I think it's a very unique situation we find ourselves in at Johns Hopkins. So for context, I moved again from the community medicine space to Johns Hopkins to try to establish a foothold on how I would impact climate and health. I happened to precede the Planetary Health Alliance coming down from the Northeast to the Baltimore, D.C. area. So they were actually recruited down by Johns Hopkins, and the Planetary Health Alliance now has an international secretariat at the old museum building. For those of you who are listening from D.C., the museum was, yes, a great museum that unfortunately didn't last, and it's now the Bloomberg Center. So 555 Pennsylvania Avenue in DC is now our Bloomberg Center, and within that is the International Secretariat for the Planetary Health Alliance. So we are so excited to have this new space and this new footprint in the heart of the nation's capital with regard to what that means in terms of our new community, our new neighbors. There's a convention center convening space within this new facility, and we're excited to be looking for partnerships and ways to collaborate and bringing expertise together. How can we best take advantage of this lovely situation that we found ourselves in? In addition to that, there is the Johns Hopkins Institute for Planetary Health. And so again, this is where we talk about sort of rewriting the playbook here. This is a transdisciplinary institute within Johns Hopkins. Again, Planetary Health Alliance, international decentralized network. The institute is sort of like the academic engine that's paired up next to the Planetary Health Alliance. So I and one of my colleagues from the School of Nursing are going to co-direct the clinical programs and healthcare section. We're looking at how do we infuse and incorporate planetary health concepts and competencies into healthcare curriculum at Johns Hopkins. We're trying to figure out how do we do no harm? How do we green healthcare at Johns Hopkins? And we're also excited to talk about development of this new Planetary Health Clinical Fellows program at Johns Hopkins. That's for healthcare providers who want to start to ramp up and be as expert as they can be regarding planetary health, kind of trying to do what I'm figuring out as I go right now. We want to make this not a redoubled effort. Let's not reinvent the wheel. Let's work together collaboratively on this. So I'm really particularly excited because it's an opportunity for us to take fellows and connect them from the Institute to that Planetary Health Alliance network around the world. I would love to be able to say that I could place one of our clinical fellows for one of their experiences with the U.S. Army Corps of Engineers to work on a project to do just what we're talking about. How do you bring a healthcare perspective to projects that may not traditionally be healthcare? Or how do we bring an engineering perspective into the healthcare sector to try to improve our own projects? So again, I'm super excited about the future, and I'm just so fortunate and lucky to be in this position. But I want you to know that these sorts of positions are starting to pop up in other places. So again, connect to our network, look us up online for the Planetary Health Alliance, for the Institute for Planetary Health. But please also feel free to reach out if there's anything I can do in terms of helping to kind of point you in the right direction, and we can figure these things out together.
Chris, this has all been so exciting and great to learn about. And I'm curious your thoughts on nature-based solutions. And Chris, how can we help? Engineering with Nature is now well beyond the program that I lead for the Army Corps of Engineers. In fact, it's a global movement. And so what can we do to leverage this program and all of the activities that we are involved with across the globe and help focus more on the global health implications of climate change and this need to take collective action now?
Oh, thank you for this platform. First, go to the Planetary Health Alliance website and look around. The concept here is building a community and making resources available. This is not a website where you join and it's just an email that comes out every so often. I am still discovering the complexity of the resources being offered. And this alliance is a decentralized community for all stakeholders. And so we would love to interact and engage with you where you stand. And that means a single person that's the cog in the big machine we talked about earlier. It's the person who feels disenfranchised and disillusioned, like they don't have a voice. We're looking to figure out how you can find, we talked about that big surface area and different ways you can engage in the projects you're working on, because I bet you have a superpower and an expertise that we need in the global community right now. Beyond that, I would say, if you are at all engaged with human beings in some capacity, just stop and think for a moment if mental health or the well-being of people or their health has anything to do with your projects. And if it does, again, connect, even if not directly with us, although I'd love to hear from you, with local and regional health systems. Everybody's got one. There's an emergency department everywhere, folks, right? The emergency department in Arkansas versus Alaska versus Thailand, they understand their local communities. And it's so important to engage these communities. You may find that you actually have a health system that's very good at being a trusted community partner, or at least that's part of what they're working on. And lastly, I would just say, don't lose hope. We're all talking about these things. We were talking again about convening people of different expertise and talking amongst each other and making sure that even people who are theoretical enemies can find common ground on these issues. And my job, again, is to discuss it in the framing of planetary health. I don't think anybody wants to get rid of humanity, or if they do, I don't think they're listening to this podcast. Hopefully not. And beyond that, it's a matter of how do we build a better future together? If we try to split and do that alone, it's not going to work. So please come together, join us with Planetary Health Alliance. But the concept there is to help you find your own superpower and ways to engage.
Well, fantastic, Chris. This is all such incredibly interesting and informative information. And you've got me excited about this. So we need to continue these conversations, and certainly looking at the website is going to be one of the first orders of action for me following this podcast. So I really appreciate that.
Oh, my pleasure. We'd love to have as many people as the next meeting that we're having is now in the Netherlands in October, I believe, of 2025. This stuff's on the website, but there are so many ways to get engaged that I would love to just continue to grow this community.
I think that your advice about reaching out to the emergency departments, using them as critical stakeholders in the project planning, I mean, that's great advice, Chris. Thank you.
If I can just add one more thing, I want to make another opportunity available. We discussed how I'm in this program called the Bloomberg American Health Initiative. Mm-hmm. And to touch on what that is, that's not special to me at Hopkins. The Bloomberg American Health Initiative is a program that was set up at the Johns Hopkins School of Public Health. And the idea is that they're trying to tackle 5 big issues in the United States. So again, for global listeners, I'm sorry, this is in the United States. But if you're in the United States and you do anything working with a community in the US, they have programs on addiction and overdose, adolescent health, food systems, violence, and the big one is environmental challenges. What I'm saying is, if you'd like to apply for a degree from the School of Public Health at Johns Hopkins, this is a program that you can supplement in, and it covers the cost of your degree. It gives you a stipend. It invites you to a summit of like-minded people from around the country once a year. There are these programs that exist that are not going to cost you anything, but may be able to give you the superpower of that public health framing in helping your teams succeed in these complex issues we're discussing.
Wow, that's a great opportunity. Thank you for sharing that.
Oh, I'm so fortunate to be a part of it.
Before we let you go back to your many, many roles, tell us a little bit about what's ahead for you.
Well, like I said, hopefully a nap again at some point before I roll back into the emergency department this afternoon. But, it's funny. We talked about the idea that things can be so anxiety inducing that you become paralyzed. And the flip side to that is you get so far down a track and a way of doing things that you burn yourself out in a blaze of glory. And I like to think I'm somewhere in between there right now. But to be honest with you, what it boils down to what's important. I am so lucky to have a supportive partner who's also in healthcare and gets what I'm doing. Because I think we didn't even get into this surprise twins we had during the pandemic. Right. So I'm not the poster child for sustainability. I've got 4 kids right now and 2 little twins here. I'm just trying to use that as a motivation for making sure I get through the rest of my MPH. I'm doing this alongside you all, anybody who wants to join you. I'm trying to make sure we do the best for taking care of our patients and teach our med students and residents. But I think, again, the big thing is just defining superpowers and helping our learners. And the message of you have something to bring to the table. I'm not going to sleep until we make sure that everybody realizes and appreciates that.
Well, your energy is certainly contagious, and what a delight to have you on this episode of our podcast. And before we close out, we've talked a lot in this episode on actions that are needed and the actions that are currently being taken to urgently address what we now understand as planetary health in all its dimensions. And so, Sarah and I are big fans of calls to action. And I was wondering, what would be your call to action for our listeners?
I swear I didn't read a lot of comic books as a kid, but I go back to this. Stop and think about where you are in the world right now and what's stressing you, and take that back to your origin story. What got you to this point? And then right now, what is that moment where you define your superpower? What is it that you can offer? And it doesn't mean that you have to be, quote, expert in something specific, but we've talked about the power of narratives and the power of story. If you've had some sort of hardship, I bet somebody is interested in listening to it, especially in light of social media. We need to talk about these issues, talk about our vulnerabilities. So my call to action again is the planetary health framing just gives you the perspective and surface area to engage these complex solutions. No one person can do them all, but recognize that you, by nature of being a human being on this planet in this critical decade, have a role to play in the future of our species.
Wow. That's a great way to wrap up the show. Thank you, Chris.
My pleasure.
Thank you so much for sharing your superpowers. This has been a really thought-provoking conversation, and I think as you've shown us the need for action from everybody now, at the community level, at the planetary level, the need for action is right now. We all need to find our superpowers, so I hope our listeners are thinking about that. And I love the quote from your recent climate change paper where you said, "Emergency medicine stands with humanity at this crossroads." How powerful is that?
Yeah.
So, wow, thanks for sharing your perspective, and thank you for putting your amazing superpowers to work every day on the numerous challenges of planetary health. You've given us a lot to think about.
My pleasure. And again, it's just heartwarming for me to continue to find people in spaces where a physician is not normally running around and being welcomed in with open arms. And likewise, I hope we can create that environment in our sector for others who are coming to work with us.
Indeed. Yes, Chris. And we've got to continue this conversation. We've got to find those intersections so that we can certainly emphasize and prioritize the integration of natural processes and nature-based solutions across the globe so that we are making a difference and that we are improving opportunities for communities and public health.
Absolutely.
Thank you, Jeff. I think Chris was a great guest to have on, channeling the energy.
Oh, that's right.
Right? To all of you, thank you so much for listening. We hope that you've enjoyed this podcast, and we hope you'll join us again as we talk about engineering with nature.
You've been listening to the EWN podcast, developed by Sarah Thorne and Jeff King, National Lead, Engineering with Nature Initiative, U.S. Army Corps of Engineers. Now, for more information, you can visit our website, engineeringwithnature.org. The EWN podcast is produced by iContact Productions for the Engineering with Nature program within the U.S. Army Corps of Engineers. I'm Dave Trafford.